So, a patient receives multiple blood transfusions for thalassemia and develops fever and chills, and there is no evidence of hemolysis. So, what is the most likely condition he is suffering from? So, first of all, clearly this is a blood transfusion related reaction, but what type it is? So, to know that, just let's have a brief overview of what are the blood transfusion reactions. So let's have a quick overview of the blood transfusion related reactions. First, we categorize them into two types, that is the immediate and the delayed. So the immediate type is that which occurs within 24 hours, and the delayed one occurs after 24 hours. Now we further classify them as immunologic and non-immunologic. So what does immunologic means? So immunologic means that there is an involvement of the immune system of the recipient. That is, recipient's antibodies, they react against the donor blood components. May it be RBCs, may it be WBCs, may it be plasma protein. So if it is against the RBCs, that is the recipient's antibodies, they react against the donor RBCs, then there will be a hemolysis, so it will be a hemolytic reaction. If they react against the donor WBCs, then it will be a febrile non-hemolytic reaction, and if they react against plasma protein, then it will be an allergic reaction. Now, what are the symptoms we will find in these three? In hemolytic, we will find symptoms like fever, malaise, flank pain, and it can complicate to DIC and shock also. And then remember, febrile non-hemolytic, it is the most common type of blood transfusion related reaction, and it presents with the mildest of symptoms like fever and malaise and headache. Then coming to allergic, so allergic again presents with like urticaria, rash, angioedema, and so on. Then trally, so trally, the pathogenesis of trally, it has a two hit model. So the first hit, it is the underlying inflammation that the patient is already undergoing on, which leads to the sequestration of the neutrophils in the lungs. And the second hit, it is the blood transfusion that we gave now, which leads to that neutrophil activation in the capillaries of the lung, and that leads to increased capillary permeability within the lungs, and then further pulmonary edema. And remember that the pulmonary edema in trally, it is a non-cardiogenic pulmonary edema, unlike that in TACO. So non-immunologic causes, first that can be a bacterial contamination. So non-immunologic means there is no involvement of the immune system, or there is no involvement of an antigen antibody reaction basically. So bacterial contamination is just due to an infection. Circulatory overload, it is fluid overload. It may be it is more prone in the patients with comorbid conditions like CKD and cardiac failure. So here, there you will find a cardiogenic pulmonary edema, the pulmonary edema due to cardiac failure, and there can be hemolysis due to physical or chemical trauma. Then in delayed transfusion reactions, again we have immunologic and non-immunologic. So in immunologic, we have delayed hemolytic, we have transfusion associated graft versus host disease. So transfusion associated graft versus host disease occurs in an immunocompetent donor T cells, and then we have post transfusion purpura. In non-immunologic, we have transfusion induced hemosiderosis. So hemosiderosis is because of iron overload. So because we are infusing a lot amount of blood within a short period of time, so it can complicate as iron overload. And there can be also complication due to disease transmission, like um, your hepatitis B, hepatitis C, HIV, malaria, syphilis. So screening for these diseases before blood transfusion is essential. So, since here the patient has received recurrent blood transfusions, there is a risk that the patient might have developed a previous sensitization to the donor's blood components. So, in that case, if the sensitization is against the donor RBCs, then there will be a hemolytic reaction. If it is against WBCs, then there will be a non-hemolytic or febrile non-hemolytic, which is the most common one. So here, since there is no evidence of hemolysis and patient presents with just mild symptoms of fever and chills, the most likely condition, it is a febrile non-hemolytic transfusion reaction.